Have you ever wondered how doctors get such clear, detailed images of what is happening inside your body, especially when looking for something as complex as cancer? A lung cancer PET scan is a crucial imaging test that helps doctors identify cancer cells by detecting areas of high metabolic activity in the body. It uses a special radioactive tracer, typically a sugar molecule, to highlight cancerous tissues, providing a functional view rather than just an anatomical one. The core reason PET scans are so effective against cancer is based on cellular biology. Cancer cells are typically more active than healthy cells, meaning they grow and divide at a much faster rate. To fuel this rapid growth, they consume a lot more sugar, or glucose. When you receive an injection of the radioactive sugar tracer, these hungry cancer cells readily absorb it. The PET scanner then detects the radiation emitted by this concentrated tracer, pinpointing exactly where the most active cells are located in your lungs or elsewhere in the body. This allows doctors to visualize not only where a tumor might be, but also how active it is. Undergoing a PET scan is a relatively straightforward process. First, you will typically need to fast for several hours before the scan and avoid strenuous activity to ensure accurate results. Once you arrive, a small amount of the radioactive tracer will be injected into a vein, usually in your arm. After the injection, you will relax quietly for about 60 minutes to allow the tracer to circulate and be absorbed by the cells. Finally, you will lie comfortably on a scanning table that moves slowly through the PET scanner, which resembles a large donut-shaped machine, for about 20 to 45 minutes. The entire procedure is generally painless, though lying still for the duration is important. A key advantage of the PET scan is its ability to detect cancer at an early stage or to see if it has spread, known as metastasis, even before structural changes might be visible on other imaging tests. Doctors often refer to something called the standardized uptake value, or SUV, which is a quantitative measure of how much tracer is absorbed by a lesion. A higher SUV can sometimes indicate a more aggressive tumor. This detailed information helps healthcare teams assess the extent of the disease and monitor how well a treatment is working by observing changes in metabolic activity. Understanding what happens during a PET scan empowers you with knowledge about this vital diagnostic tool. It provides your medical team with invaluable insights into the nature and spread of lung cancer, guiding critical decisions about diagnosis, staging, and ultimately, tailoring the most effective treatment plan for your specific situation.